Assalamualaikum and a good day. My name is Fatisha Zana binti Nazri with the metric number A20EC0036. So this is the presentation video for my PSM1 with the topic multi-user interaction in handheld augmented reality for blood flow simulation in coronary artery. So my supervisor is Dr. Go Eksu and my co-supervisor is Dr. Jasmine Hawiwan. In this presentation, it will cover introduction, literature review, system methodology, system requirement, and conclusion. So for introduction, according to Udasima, Nagisha, and Ramaya, there are almost 436 cases had evidence of arteriosclerotic in coronary arteries. So to prevent this from happen, perform an angioplasty procedure by placing a stent into a partially blocked artery. Hence, using AR can help students to practice to make decision where to place the stents on the patient. Therefore, the aim of the project is to develop a multi-user interaction in handheld augmented reality for blood flow simulation in coronary artery. For the problem statement, blood flow simulation is traditionally difficult for students to learn due to its complexity and dynamic process. It is also difficult to imagine the real process of the blood flow through the heart, also the loop of narrow or blocked blood vessel. However, by taking augmented reality, most of the students can improve both knowledge and skills. Second is during the stent placement, the coronary artery might be tear. So in order to prevent it, students can use this purpose application to practice to place the stent. The objective of this project is to analyze the related requirements needed for blood flow simulation in aneurysm blood vessel. Second is to design handheld AR application and multi-user interaction for the stent placement. And third is to evaluate the functionality and usability of the application. And for the scopes, this application need to compatible with Android smartphone or tablet. Develop the handheld AR application for blood flow simulation. One host and 3 clients can interact and work in the apps to practice the procedure together. It is required AR marker to display the virtual blood vessel and its tool. Using joystick UI to insert the stent into a blood vessel and the UI button to expand the balloon inside the stent. So this is for the literature review. Augmented reality is divided into two types, which are marker-based AR and markerless AR. Marker-based AR requires image or object to activate an augmentation, while markerless AR can be used without markers. So for this project, I will use marker-based AR. Next is blood flow simulation in coronary artery. There are two blood vessels, which is normal blood vessel and narrow. So for the normal blood vessel, the blood will flow normally. But for the narrow blood vessel, the build-up of fatty deposit or plaque that narrow the blood vessel. It will block the blood flow to the heart muscle and it can cause a chest pain. One of the procedures to manage this disease is coronary angioplasty that use a small balloon to reopen the blocked artery and help blood flow through it better. The provider may also insert a stent to help the artery to stay open. Next is multi-user interaction and handheld AR. So for multi-user interaction, first is touch-based interaction. So the interaction technique in which a mobile phone is able to touch a display at any position and control the digital content. It also involves all touchscreen inputs by fingertips to manipulate the 3D objects in AR. The advantage of touch-based interaction is no hardware is required beyond the mobile device itself. So for handheld AR, handheld device is a computing device that are smaller yet more portable compared to other computing device. For example, phones. And for application, it's Pokemon Go, IKEA mobile apps, Equivins, and many more. So this is the existing application that related to the medical health. First is visible bodysuit, anatomy AR, and Equivin. The difference between these three existing systems with this project is multi-user. All of the three existing apps are not multi-user, but for this proposed project, we'll implement multi-user interaction. For methodology, this project will use waterfall method that contain 4 phases, which are analysis, design, implementation, and testing and evaluation. So for analysis, first is to studying the blood flow simulation and analyzing the requirements needed for multi-user interaction in handheld AR. For design, it will design the application and the algorithm that involve, design the multi-user interface, and implement handheld AR. For implementation phase, it will allow multi-user interaction using photon unity networking. And phase 4 is testing and evaluation. When all of the development tasks has been done, there will be a usability testing and evaluation by the medical students. So this is the project requirements. For software, it will use Windows 11, Unity 3D, Euphoria SDK, Visual Studio Code, Blender, and Photon. For hardware, laptop, mobile phone, tablet, and AR markers. Next is system flow. For system flow, it will involve host and client. So the expert or lecturer will become a host, while the students will be the clients. The host will create the room and the client will join the room to access the same AR environment. There are several AR markers that they need to scan to display the 3D object. For example, when they scan an AR marker A, it will display the normal blood vessel. When it combine with marker B, it will do the animation. While AR marker A will combine with marker C, it will display the narrow blood vessel. Scan AR marker C with AR marker D to do the stand placement. The host can perform stand placement, while the clients need to ask for a request to do the stand placement together. After finish all of the process, several questions will pop up on the client screen to test the knowledge gained from this application. This session will be monitored by the host. Next is database design. So the room name created by the host will be stored in the database. The result of the modified blood vessels will also be saved in the database, and the attributes of the 3D models that are found in the database can be modified again by the users. Next is the GUI. So this is the interface before scan the AR marker, and after the user click the open AR camera, they will require to scan the AR marker and it will display the normal blood vessel. And this is the example when the animation occur, transparency mode, example to trigger, and the zoom in. And this is for the narrow blood vessel. The first one is for animation and transparency mode. And this one if want to do the stand placement. So this is the expected GUI. Summary of initial finding in PSM1. From PSM1, the research on the AR concept contribute in the knowledge of the related topic to this project. The existing systems were also reviewed for better implementation, and the proposed application is expected to enhance the medical students' experience in learning the blood flow simulation in different conditions. For planning for PSM2, on PSM2, more interaction will be added and the user interface will be designed better than the expected design. The process of develop the system will start earlier and follow the Gantt chart that have been created. Next is conclusion. As the conclusion, this project is about development of a multi-user interaction in handheld AR for blood flow simulation, where this application will help the medical students to learn and practice the flow of the blood and fix the narrow vessel in a partially virtual world using AR. This way can improve the understanding and skills in the medical field. So that's all from me. Thank you.